We are back with another episode of the Skinfluence Podcast. I'm your host, Dr. Dustin Portella, board-certified dermatologist.
And I'm Austin Liam, a physician assistant. We're here working with Dr. Portella in Idaho.
Good old Idaho. Doesn't feel like Idaho this winter.
No, it's doing its own thing. It's
we have
weird.
not, in Idaho, in Boise at least, gotten any snow this winter.
No.
Maybe like 1/8 of an inch that was gone by noon one day.
One day.
So,
and it's been warm.
Yeah,
for Idaho.
Warm. So it's going to be a dry summer, I'm afraid.
I know people are kind of freaking out about it.
But today we are going to be talking about, I think, a fun topic. All these like home ancient remedies that your grandma used to try to get you to do to cure your skin problems. There's so many others for colds and coughs and things that we could probably touch on. We're focusing, of course, mostly on the skin today. What grandma got right and what grandma got wrong.
Yeah. And looking back on a lot of these, I'm like, I probably did most of it.
Yeah.
Most of the ones that we probably shouldn't be doing.
Did you have that person in your family who was like always jumping in the medicine cabinet to pull out random things for every little illness?
Old stuff too, where you're like, that shouldn't, I don't know if that should be used anymore. Or going to the to the kitchen for remedies. So. Well, we're going to get right into it with toothpaste for pimples. This is something that's been around forever and surprisingly has still not gone away. I don't know how it's still persisting lately. I know I've posted about this on my own social medias. You've posted about it on your social media. We don't recommend doing toothpaste for your pimples.
Right.
There's too many ingredients that are going to be really irritating or drying to the skin. Mint and things like that can sometimes be soothing to pimples that can be really inflamed and painful. But overall, there's especially fluoride in toothpaste has been known to cause periorificial dermatitis, which is one of the most common things that we see in dermatology nowadays.
Yeah. The other thing that I look at is if toothpaste was really good on pimples, then wouldn't the skincare companies put those same ingredients in acne creams?
Yeah, you're 100% right.
They don't. I mean, it's an FDA-approved product that are readily available.
Yeah.
But the fact is, it doesn't help your pimples. It's likely to irritate your skin. So if your grandma had you putting toothpaste on your pimples, grandma was wrong.
She missed that one. You'd think that if it did help, you'd see people with acne coming in, but their mouths were perfectly clear because all the toothpaste that gets around on your lips and stuff. But no,
good point.
No, it's a wives' tale.
Old wives' tale.
Okay. Well, what about lemon juice for dark spots? That's another one that I see fairly frequently.
Right. So this is an acidic, citrus juice, and there's probably some evidence that it could help to lighten some dark spots, but the risk isn't worth the reward, in my opinion, because lemon juice is more acidic than it should be for your skin. Now, your skin does have a slightly acidic pH to the moisture barrier, and when you're using skincare products and they say pH balanced, all these things, they're trying to mimic the natural barrier of your skin. But lemon juice is more acidic than your skin, and so you're likely to cause irritation. And the biggest risk to this is phytophotodermatitis.
Totally.
When you have certain citruses or other plants on your skin, celery is a big one, where limes, lemons, you get it on your hands, you get in the sun, and it leads to a phototoxic reaction on the skin where you're going to get a very painful rash that's quite itchy or painful. And the discoloration that it produces will last for weeks to months.
Yeah, and it's usually a weird-looking discoloration. It's very abnormal.
So lemon juice, keep it in your drinks, keep it in your recipes, but don't use it on your skin because there's better products out there that will do a better job on dark spots and don't carry the same risk of creating a terrible reaction on your skin.
Yeah. I've seen a big push for like the face ice baths in the morning and people are squeezing lemons in there. I'm like, oh, don't do it.
Yeah.
Don't do it.
Yeah. If you really love doing that and squeezing some lemon in there, rinse it off really well afterwards because you don't want to go outside and have remnants of the lemon left on your face.
Yeah, totally.
So, then we're getting into the classic spa look, and that is cucumbers for puffy eyes.
I have 3 girls at home, 3 daughters, and when they want to do something nice for mom, they'll cut up a cucumber and put it on her eyes. And, this probably doesn't carry the same risk that lemon juice does, putting it on your face. And it's It's not going to be incredibly harmful. I don't think there's a lot of chemicals in that in the cucumbers that are going to cause irritant contact or allergic contact. It could be moisturizing at most, things like that. But are there better alternatives? Probably.
Probably. Overall, I put this in the category of if you like it, it's not harmful, go ahead and do it. Especially if they've been in the fridge and they're cool. You might get a little temporary depuffing.
Yeah.
And if it's an experience you like to have, the downside is minimal. I say go ahead and do it. But also, I think there's better things.
Yeah. Take the photo for the gram. It's fine.
Yeah.
And you're good to go.
Yeah. Let the spa do it when they're pampering you. That's fine.
Yeah.
But,
I do like the smell of cucumber.
Yeah. So. Then you're just throwing away food because, I mean, I'm not going to eat it after I put it on my face.
That's true. I hope not. The spa saves them for later.
Yeah, exactly.
They put on your salad.
And then we've got egg whites for skin tightening. I've seen a lot of people actually post on this. They're making their own mask out of egg whites on social media. Any opinion on that?
Yeah, I highly recommend against doing that. So egg whites can carry bacteria called salmonella.
Yeah.
And that's what you're really putting at risk there is you're introducing a bacteria that could get into your eyes, it could get into your nose, and it can cause an infection to fester. So I don't recommend doing that. The smell of egg whites alone would deter me on that one.
Yeah.
And having to like get the yolk out, I don't know. That just seems like too much work. I would recommend against doing that. I don't think people are getting the benefits they think they are. A lot of the nutrients and things that we are putting on our skin don't get through the skin barrier.
Right. There's a lot of albumin and other proteins, and they're just too big to pass through the skin.
Exactly.
As they dry, they're going to tighten, and you're actually going to feel something and maybe look and be temporarily like tightened. But then you can't go out like that because you're going to start flaking.
Yeah.
And so you wash it off, the effect is over, and the risk of infection is real. This is why they tell you don't eat raw cookie dough, which I never do.
And I never do either.
So far unsafe.
Yeah.
But yeah, egg whites for skin tightening. People are also using eggs in their hair. Again, I just think there's products that are made for your hair, for your skin, that will do a better job with less work. And that's one of the things with a lot of these is the work involved to get minimal result with risk. I just would never take the time to do it.
No. And yeah, I'm the same way. I'm like, I have better things that I'm going to be doing during my day. And there's so many good products out there that are readily available nowadays that will give you the benefit that you want.
Plus the price of eggs. Are you even saving money anymore?
Yeah, for real. You're flexing hard if you're making egg white
exactly.
face masks.
People used to pose in front of private jets, and now it's like, look how many eggs I got.
Eggs. That was like during COVID when people were keeping houses. You're like, wow, that's a big flex.
That's a big flex.
Well, another one that we see is honey for wound care.
Right. So this one I'm on board with by and large. Now, I don't think you should just go buy the teddy bear that's sitting on the grocery store and start pouring that on your wounds. There's certain types of honey. Manuka honey is generally pretty good for wounds. And there's a brand called Meta Honey, which makes honey for
medicinal
wounds specifically.
Purposes, yeah.
And this one, Grandma got right, I would say, because it does have a lot of antibacterial properties. So it can help to kill bacteria and foster an environment of good healing. But again, it's sticky, it's messy a little bit. So I don't find it particularly easy to use.
Yeah.
But we have used Meta Honey in the clinic in wound care occasionally.
I've seen it used in a hospital setting once, but it's not something that we reach for every time.
Yeah.
For sure. But yeah, there are a lot of antibacterial properties. So I agree. I think that's one thing Grandma did get right.
Another thing, my grandma actually had an aloe plant. And so aloe for burns.
Yeah. I can remember growing up, my mom had an aloe plant, and if we got burned, she'd break off the plant and rub it on and cut another little piece and rub it on, and it's soothing.
Yeah.
Yeah.
So aloe is tried and true. This is a legit one, and it can be helpful for burns. It's kind of that gel-like texture, so it's not too occlusive to hold in the heat, and it will help to soothe the skin. When you have an injury in the skin, keeping it moist can often be helpful.
Totally.
You're going to get more heat transition out of the wound if you have a liquid on there of some kind. And so aloe for burns, I think, is great. If you like to keep an aloe plant, by all means, you certainly can.
Yeah.
You got to tend it then. I don't have much of a green thumb.
Yeah, neither do I.
I just buy a bottle of aloe
Yeah.
at the store.
And that's how you kind of know it's readily available at the store. Everybody has it in the far back of their cabinet somewhere in their house. It's hiding there.
Yeah. And now they put all these artificial colors in them now, though. Like you get the blue one, the bright green one.
Yes.
I'm like, I don't know. It's probably not harmful, but just aloe is fine.
I like the colors.
Yeah. Do you?
I'm a sucker for colors. Like I'm like, ooh, that one looks good.
Yeah.
I don't know. Well, how about apple cider for acne?
Apple cider vinegar.
Vinegar.
Yeah.
Yeah.
So this is another one that doesn't go away on social media.
Not
People
the yummy
are using,
apple cider.
No. Well, don't do apple cider for acne either.
Yeah.
But apple cider vinegar, no, I'm not on board with this one. Again, it's quite acidic.
Yes.
And especially if you're not diluting it, then you could cause, irritation on the skin. You get an irritant contact dermatitis. Apple cider vinegar is just too strong. It's stripping to your skin barrier at that level of acidity. Now, people might make the argument to go ahead and dilute it and then put it on there. Again, I'm in the camp that there's things that are just going to work better.
Yeah.
And this smells bad.
It smells horrible.
You don't want to walk around smelling like vinegar because it's quite pungent.
I can remember when I first was in practice in California, I had a friend call me at like 9 at night, and he was like, my wife put apple cider vinegar all over my kid's molluscum bumps, and I don't think it's going well. So he brings him over, and he had just blisters around the molluscum. The kid was crying, and it didn't touch the molluscum.
It just got on the skin.
It just got on the skin and irritated the heck out of the skin. So we helped him with that, but I don't recommend putting apple cider vinegar on your skin in general.
I've seen people using apple cider vinegar to remove moles at home because, again, it's acidic
very
and you
acidic.
put it on every day. But again, the risk, if you treat a mole that's actually cancerous with apple cider vinegar, you're putting yourself at great risk. So apple cider vinegar on the skin gets a definite no from me. Grandma was wrong about this one.
Grandma was wrong. It's one of those you don't have to be able to eat your skincare.
Exactly.
Situations.
But the next one, oatmeal baths.
Yeah. Oatmeal baths can be beneficial, especially for people who have some sort of barrier dysfunction disorder like eczema, where they just need something that's soothing, something that's moisturizing. So oatmeal baths can definitely do that for you. They can be very soothing to your really red, raw, itchy, flaky skin, help your skin to repair itself and repair the barrier. So I have no problem with oatmeal baths. If people feel like they want to do them, they can definitely do them. And there can be some benefit there.
Aveeno is probably the biggest skincare brand that uses a lot of colloidal oatmeal in their products. And they make little bath packets. You can actually pour the powder in the bath.
Oh, really?
And it's in a formula that's safe to go down your drain and everything. Because if you're like dumping the oatmeal in there, you gotta like scoop it out because you're gonna clog your drain up, and then the plumber's gonna wonder what in the world are you doing. So oatmeal baths get a thumbs up. I like that.
Yeah.
So
well, what about turmeric masks?
Turmeric, I think, has a lot of good properties to it. It's very anti-inflammatory. There's cases where I'm having some of my patients take it who have acne to try to avoid, have something that's anti-inflammatory, but is not an antibiotic.
Sure.
There's at high doses of turmeric, there's actually cases in the literature of liver injury from high doses of turmeric. So even over-the-counter supplements are not without their risk. But if you're getting turmeric powder and making your own mask, again, I think this can be irritating to the skin. It's time-consuming, and it's got such a capability to stain clothing and leave some discoloration on the skin that the risk, again, I don't think is worth the benefit. I don't think it's super well studied as a mask to improve skin problems. Yeah. So this is a no for me.
I would agree. It's a no. I've cooked with turmeric before, and my hands were yellow for like a day. So putting that on my skin, I don't know if I would recommend that either. But yeah. Well, what about butter and oil on burns? It's another one that we see.
Yeah, I've heard of this. It's not something I've seen on social media a whole lot.
Same.
The idea is that it's going to coat and it's going to stay really well because it's thick at room temperatures. It's going to solidify just a little bit. But if you have a new burn, you want to let some of that heat escape. And if you put butter or oil on there, you're providing an occlusive barrier that's going to trap the heat in a little bit more. And overall, this is not something that we would ever recommend on burns.
Yeah.
So butter and oil on burns, avoid that. Again, this is one of the things great in your food, not on your skin.
Yeah. I would agree with you. I haven't heard much about this one, but just off the cuff, I'd be like, no, I don't. It doesn't seem like something I'd want to put on a burn, and for those reasons that you talked about. But.
Yeah, a fresh burn, run it under cold water. Put some ice packs on there. Once the sharp pain has kind of died down, the heat has kind of come out. Then, if you want a barrier on there, use some Aquaphor, use some Vaseline, things that are made to go on the skin.
Totally.
So. Those are the bulk of the old wives' tales that we've got. The one, I don't even know what goes into it, but when I was sick as a kid, this is not necessarily a skin thing. My mom had this old recipe from her mom to make what's called a mustard plaster. Have you ever heard of this?
I've not heard of a mustard plaster.
So obviously, if you've got a chest cold, like people rub Vicks Vapor Rub.
Totally.
And I like that.
Yeah.
Some people get sensitive to the menthol and stuff that are in there, but it just opens you up. But a mustard plaster was like super Vicks. I don't know everything that goes into it, but I used to ask for it because they would get warm and they would make your chest feel good. They smelled, they had quite an odor.
Yeah.
But my mom would paint that thick paste on my chest, and then we'd put like a towel over it, and then I'd put my shirt on and I'd fall asleep.
It probably feels good.
It felt good. I don't know what goes into it. I'm going to have to look that up.
Yeah.
But that was definitely an old wives' tale. I've not heard of that since I was a kid.
Yeah. I had one where whenever we got sick, my mom would bring us a Coke from McDonald's.
Really?
In her mind, Coke killed everything inside your body. She's like, this is going to kill the bacteria. And I'm like, and now every time I get sick, I feel like I need a Coke from McDonald's. It's the Pavlov dogs.
Pavlov conditioning to this.
I'm like, I get a cold. I'm like, I need to get a Coke.
Well, Coke from McDonald's is different than all other Coke.
It tastes way better.
So they have a proprietary arrangement with the Coca-Cola company where it doesn't come pre-mixed, like the syrup and everything. So they infuse more carbonation into it. So you get more bubbly. They have their own ice. Like, it is a different experience to have a Coke from McDonald's.
Yeah.
So,
well, I sometimes I'll even get a Coke when I'm sick just for nostalgia.
Yeah. Very good. Well, let's jump into a little Did You Know?
Cleopatra has made an appearance in many episodes in the Did You Knows, and she has reared her face again.
Yeah.
Because some of the first known instances of using aloe vera to help with healing is with Cleopatra.
She's like the OG skin influencer.
She really is.
I wonder if she had a way to get the word out. Be like, y'all should be doing this with your skin.
She's tablets. Just chiseling the tablets.
Chiseling a tablet. Send it out.
Send it out to the people.
She was the beauty pioneer for sure.
Yeah,
Everything
apparently.
goes back to her. So. Well, talking about the honey, studies have shown that the right type of honey, like Manuka honey, can kill up to 60 different types of bacteria.
That's
Many of those things that grow on our skin, the growth can be inhibited by using honey. And that's why it is very helpful for wound care.
Yeah, that's awesome. One other one that we haven't touched on that has come up a few times in clinic is something called the black salve. And it's something that patients will claim this salve cures cancer. Have you encountered this with your patients at all?
Yeah. Black salve is one of those things in like I don't even know what to call that circle of people that uses black salve. But black salve it's an unregulated paste that people will put on different things. And a lot of people use it to treat skin cancer. And it's very corrosive to the skin. I mean, it literally chews up and eats and destroys anything that you put it on.
Do you know what it's composed of?
Yes. So I just pulled this up. So zinc chloride, a strong inorganic synthetic chemical that acts as a corrosive, causing severe tissue damage, irritation, and burns. It's the main ingredient by weight. Also, bloodroot. It's an alkaloid that kills both healthy and cancerous cells. So this is not selective.
Bloodroot.
Bloodroot.
That sounds great.
And then DMSO is often in it. DMSO is another one of those compounds that people think the government is suppressing because it cures cancer and everything.
Gotcha.
I have patients that put this on rashes. I have patients that drink it. And then chaparral, Laurea mexicana, a bush that is alleged to have medicinal properties. Graviola, a fruit tree extract. And then there's several other roots that it lists here. But the main thing is the zinc chloride and bloodroot, and then DMSO. And I recently saw a patient who, when they were a kid, they had a parent that wanted moles removed from their kid, but they didn't want to pay for it.
Right.
To have it done professionally. And they put black salve on several moles on this child. No. And to this day, they have incredibly bad scarring all over their back.
No
to
kidding.
The point where like they wouldn't want to wear a bathing suit and show that off because it looks really, really bad.
Yeah.
And I just feel like it borders on child abuse to do that to a kid. If you're an adult and
it's
you decide
painful.
It's very painful. I mean, it's corrosive. It just is caustic to the skin. So black salve, of all the things that we've talked about, is the worst.
Yeah.
Don't do black salve. It's not some secret conspiracy that doctors don't want you to know about because we don't make money off it. No. We probably make more money off of black salve because then people are coming to us for fixing the problem.
Exactly right. I've had multiple patients, not recently, but years ago, who used black salve to try to treat some skin cancers. They refused our Mohs procedure, whatever we were offering them, and they came back probably a couple years later, and their cancers had like tripled in size, and now they're asking for the surgery, and we're doing a massive surgery on them. So
I think for the listeners, you have to understand selection bias, because if you're into black salve, you'll get on YouTube or Reddit or wherever, and people will be talking about this. Like, I did this, here's my before and after, it cured this, I don't have any problems. But you're not going to see the people that it didn't work for, that got hideously scarred by it, or that then had to go and have a huge cancer surgery, because people are embarrassed and they don't want to go on and be like, I tried this, it didn't work. There's probably cases out there of people on the internet saying, hey, I was stupid, don't do this. But understand selection bias, that when something in the natural health circles worked for one person, they're likely to talk about it, but it's not a representative sample of the harm that could be done by a lot of these types of remedies.
Yeah.
So that was a little longer, did you know? But we are going to jump back into the podcast and let you know what you should be doing instead of these old wives' tales.
We have answers to all of the old wives' tales. So let's start off with what we did at the top. Pimples on toothpaste. What would you recommend instead?
So instead of that, easily available over the counter, benzoyl peroxide or salicylic acid.
Yeah.
They're not a prescription, and I still think that they're among the best spot treatments for pimples.
Yeah.
Is putting on benzoyl peroxide or 2% salicylic acid. You can get pimple patches now that have salicylic acid infused in it. Hydrocolloid bandages are great. If you've got a pimple, you want to try to shrink it down overnight. They're not expensive. These are much better options when it comes to a pesky pimple that you're trying to get rid of quick.
Totally. I found that very often one-size-fits-all type treatments don't treat anything really well.
No, exactly.
So you need treatments that are specifically meant for that thing.
And don't brush your teeth with salicylic acid.
Yeah.
It goes both ways.
That probably would taste really good.
We previously talked about lemon juice for dark spots.
Yeah.
What would you recommend if somebody has pesky pigmentation and they'd like to get rid of it?
Yeah. So there's a few things that we could do for pigments. One is a prescription called hydroquinone that we can prescribe to help. It helps basically reduce the amount of pigment being made in those areas that you're putting it. That can be beneficial. We talked about in the previous podcast the Radiant Tone line from Eucerin, which has the ingredient thiamidol, which can do that, as well as vitamin C. So those are all good, better alternatives than doing lemon juice. If you're determined to do something that's from like a plant, vitamin C serums. Go ahead, just use this ascorbic acid. There you go.
That could be beneficial. Niacinamide has a role. I don't think it's the best for pigmentation, but it's often a good adjunct, and it's included in many of the dark spot serums already.
Totally. So. What would you recommend instead of cucumbers for puffy eyes?
So if you're waking up with puffy eyes, Cucumbers, I think they just take time, and then you're throwing things away. There's a lot of eye creams out there that can help, something with caffeine in it.
Yeah.
And if you want that cooling experience, keep it in the refrigerator before you put it on. I am not the hugest fan of jade rollers or the gua shas, but they can temporarily depuff.
Yeah.
You can put on an eye cream or even just hyaluronic acid and then do a little lymphatic massage to help move the fluid. But if you're persistently puffy, ask why are you puffy in your eyes every day? And do you need to change your diet? Do you need to not drink alcohol at night? Are you getting sufficient sleep? So look at the underlying cause. Get to the root. I want to know the root cause.
Yeah. Yeah, very often when my patients come in and say, what can I do about puffy eyes? I ask, how's your hydration? Are you drinking enough water during the day? And stuff like that can be really beneficial. Caffeine for puffiness can be beneficial. Yeah. Don't go pouring Red Bull, since we're talking about OTC, or like DIY stuff. But caffeine can be definitely beneficial to help.
Instead of dipping my face in water in the morning, I also shouldn't dip my face in Red Bull.
Yeah, no. Oh, that's funny. What would you do for skin tightening instead of egg whites?
So skin tightening, this is the type of thing where I don't think there's a lot of creams that are super great with skin tightening yet. Sunscreen is the number one thing to prevent the problem from happening, because most of the skin laxity comes from UV damage. It's going to age you. It's going to lead to the development of wrinkles. Then using a retinol, I think, can help, because it's going to help to promote better collagen in the skin. And I do think that we're starting to see some peptides come onto the market that are stimulating collagen in novel ways that do help to tighten the skin. I've been learning a lot about a product called P46 from Dr. Whitney Bowe Beauty, and their before and afters, they're like legitimate, validated, same lighting, same pose, same patient. The before and afters look really promising on that product, and it's primarily a peptide product with some hydration. And so I think that peptides may be an emerging area, but if you really want skin tightening, this is where you're probably going to get into devices with your dermatologist, laser treatments, and things like that to give you a quicker result and a long-term result. And this is one of those areas, depending on how much progress you're trying to make, you have to think about, all right, if I buy this cream and this cream and this cream, and I have to use them for 2 to 3 years and rebuy them every couple of months, how much money are you spending? And maybe you'd actually come out ahead and get there a lot faster by just paying for a laser treatment.
Right.
So I think that there's ways to do it with topicals, but it's a long road and you have to be patient for it.
Yeah. Setting expectations of understanding that this is not something that could be done overnight and not something that can be done incredibly easily is always important.
Instead of making a turmeric mask or a mask with vinegar and baking soda, whatever people are making, what would you do for like a mask at nighttime?
Yeah. So there's a few different ways to approach it, because basically what turmeric is trying to do is moisturize the skin, help make the skin be a little bit more youthful, glow a little bit, plump the skin. Ceramide-rich face masks can be beneficial. There's a red light therapy can probably be a good adjunct to that as well. Typically, when we're looking for face masks and things like that, you could do just at home. We've talked about this before, slugging and things where you can put a moisturizer on and then put like a nice thick Vaseline or Aquaphor or something like that if you're really that dry. But using ceramides is usually the best way to lock in moisture and give your skin that nice plump
ceramides.
look.
I like squalane oil. I think that's another really good product.
Yeah.
I'm not totally opposed to things like castor oil or coconut oil. I think that there's better things that are easier to use, like a good ceramide-rich cream. Yeah. So there's options out there, but they're going to be less messy and easier to use. They're not going to stain your skin.
Totally.
Things like that when you use them. And we talked a little bit about the alternative to butter and oil on burns. So cooling it down, using ice packs. When it's cool, then you can start to put on an occlusive like Vaseline or Aquaphor. So, but let's see, when home remedies are helpful. I don't really know what to say about that.
Yeah, I mean, I guess we've talked about some of them, like aloe, honey, oatmeal baths.
Yeah, we already covered that. Okay, the DIY risk, and then encourage safe experimentation.
Yeah. Okay.
So overall, a lot of these come from, I think, a good place of people wanting generally less expensive options, things that appear to be natural, and maybe they like the process of whipping something up. But there's, in my opinion, curious to see what you have to say about it. There's a lot of risks when you DIY your skincare.
Totally. What I would have to say about that is you have to, a lot of these ideas are coming from somewhere. They're coming from somebody typically. If you're getting a lot of your ideas of how you can take care of your skin or help heal your skin from influencers online saying, this is the type of thing you should be doing, it should be coming from a reputable source, number one. So if you're getting all of your ideas from somebody who just throws out all these different ideas, but doesn't present any science behind it, doesn't present anything that's really going to back what they're saying, then maybe not the best source of information. Yeah. Also, you have to look at people what are their motives? Are they selling turmeric masks? Mm-hmm. You know, a lot of people will sell things that have no good benefit, or just because the company gave them free masks, or the company's paying them to do it. So look at who you're getting your information from. Are they a reputable source? Are they unbiased? Are they trying to sell you something? And then kind of go from there.
I've been inside many cosmetic labs where they actually make the products. Yeah. And the quality control is insane in those places.
Oh, I'm sure.
The way that they source the ingredients, the way they store the ingredients, they have sometimes every hour they're recording the temperature of the storage room, the humidity. They're precisely measuring things when they combine them. They have to be stirred for hours and hours. They pull off things, they sample it, they test it for quality control. I mean, it is quite a process when they make these products. And when you are whipping something up in your house, you have to ask, what is the temperature that this has been kept at? Is it too humid? Yeah. I know just simply trying to make a cake or cookies at home, I can do it, and sometimes it'll taste great, and sometimes like I mess something up.
Yeah, you're gonna get different results.
I don't know. It doesn't taste the same to me.
Yep.
And so, but you don't necessarily know that when you're putting it on your skin. Did you put too much of one ingredient in? Was that ingredient expired? Has it been contaminated by bacteria?
Totally.
And I've seen people that are making their own sunscreen on TikTok by using zinc oxide powder. That's not been shelf tested for stability. Yeah. You don't know if it's thoroughly mixed. So you could start using that and you get great coverage in one area, and then you get another area where it's mostly just the coconut oil and you don't have a lot of zinc in there.
Right.
Even if you've tried to mix it well, and now you're burning in some areas. And so it's very difficult to replicate the same formula time and time again and get the exact same result when you're doing the DIY approach. And so that's why we generally just don't encourage it.
Yeah.
There's so many products available that are inexpensive, that you can get over the counter, that have good quality control measures in place. They have recalls available. If you purchase something and it gets recalled, the store will notify you, the company will notify you, so that they're keeping you safe. And if you hurt yourself doing a DIY, you've got nobody to blame but yourself. And now you're spending money to try to fix a problem that never had to be there in the first place.
Totally. Another thing to be wary of is ChatGPT. Although it is a great source of information, what I found very often is I will ask it a question, like a yes or no question. You'll say, yes, this is okay. This is a good thing. And then you'll respond and say, well, I actually had a reaction to this. Oh, I'm sorry, this is not a good, it'll switch what it's saying back and forth. So I wouldn't just use straight ChatGPT when you're creating these types of things. Often it'll give you good unbiased information, and I use it often for different things, but you have to take it with a little bit of a grain of salt sometimes.
Absolutely. I mean, maybe Skynet will come after me for saying this someday, but it's not intelligent. It's only trained on tons and tons of data that's already out there on the internet. Yeah. And some of that is bad information.
Yes.
And it will pull bad information because it's seen it so many times on the internet, and it'll present it to you as this is a thing that people are doing and this is great. Yeah. So you should not be at this point trusting your health to it.
Yeah. Agreed.
But those are the old wives' tales. Some of them are good, some of them are bad, some of them I'm indifferent about.
Yep.
So I would be very curious to know from the audience. You can let us know, send us a message on Instagram, leave us a comment on YouTube. Which of these have you tried, and what ones have you tried that we didn't cover? I'd love to know about other old wives' tales that you've found helpful or harmful to your skin.
Yeah, there's probably so many we haven't even touched on that are out there that people have been passed down families. So let us know.
So we'll close out again with the product of the week. We want to share again Elta MD with you guys. This is the favorite sunscreen for so many people in our office, so many of our patients, and we use it all of the time. And we've got a special link through the Air Skin store where everything that you want from Elta MD is 15% off, not only for the first purchase, but for every purchase that you go back and make in the future. And it's very generous from Elta MD to do that. It's shipped straight from the manufacturer, so there's no counterfeit product. And this is a great place to buy all your skincare. All of it's dermatologist approved, dermatologist curated platform. So check out the Air Skin store. We'll share the link to our Elta MD favorites.
Yeah, I've been recommending it to my patients, and they've been really appreciative. And it's their discounts are good.
Mm-hmm. Very good. And for life. It's not just like a one-time purchase to get you hooked into the platform. So thank you for joining us on this episode of the Skinfluence podcast. Follow me on all social media platforms at Dr. Dustin Portella.
And you can follow me on Instagram, TikTok, YouTube, and Snapchat at Austin Lee PAC.
Leave us a 5-star review wherever you listen to podcasts, and we'll catch you on the next episode.